We'll move then to special orders of business. 5A, Councilor Phillips.
Thank you, Mayor Bennett. So I am thrilled to introduce this motion. Help me with the process. This is my first time introducing a motion.
What you do is make the motion. And that'll
okay, I move the motion introduced in the documents to a resolution declaring healthcare a fundamental right and supporting state and federal legislative action to achieve universal high-quality healthcare.
Second.
Anderson. Okay, now, Councilor.
Thank you so much, Mayor Bennett. I really, if you can't tell, I'm really quite excited about this opportunity to testify or to submit this resolution in favor of declaring healthcare as a fundamental right. And I do remember what I wanted to say to Mr. Bravo, who spoke earlier, and to all of the people who submitted written or video testimony this evening, which is thank you. Especially to Healthcare for All Oregon, who I worked with, as well as many other community groups and individuals throughout Salem, to get what I think is a very strong resolution. As an emergency room doctor practicing healthcare in the busiest emergency room in the state of Oregon, I cannot tell you how many times I've seen people harmed by either the rationing of care or underinsurance or lack of coverage. I'm not saying that our system is foundationally flawed, but I think we all have to agree that we could do better. More people need better health care. And while some of the testimony tonight, was definitely very, very passionate, I'm not asking for any, specific fixes tonight, other than what's outlined in this resolution. I've tailored this to, speak to local things that are happening. So in the last legislative cycle, there was the passage of Senate Joint Resolution 12, which refers the question as a ballot initiative to the state of Oregon, which is that we'll be voting on whether or not we agree that healthcare is a fundamental right. And we're asking the city council weigh in on this, and that we take the position that people should vote yes. It's changed over the years since it was introduced by Representative Greenlick, I believe. In the past, we're saying a fundamental right as opposed to just saying it's a human right. And we're making sure that we don't take away from our other constitutional obligations like education. Beyond that, we're stating our support for the state of Oregon to continue their work through past legislation on achieving true, universal coverage. The reason why I think this is so timely is Oregon was above the average. We got to 94% coverage in the state, but as a result of the pandemic and other, things that are happening as social determinants of care, we've slipped a bit and we've gone down to 92 or less percent. So there's continued work that needs to be done. And then finally, we're asking our federal delegation to keep working on achieving things like waivers that would allow states like Oregon, who are doing things that are more local and cutting edge, to get to that true 100% coverage, so that they can continue without running afoul of the CMS and criteria that exist at the federal level. So this is tailored to be local. It's not a specific prescription for how to get there. This is not an endorsement of Medicare for all. I might be supportive of single payer individually, but that's not what I'm asking City Council to weigh in on. I'm just saying that we agree with the words, healthcare is a fundamental right, and that we keep working to be better as a state in terms of providing healthcare for everybody.
Great, thank you. Councilor, I had very good. I had a question about this. Does this take into account alternative medical models, chiropractic naturopathy, other kinds of care systems that may not be part of the Western medical model? Does this pick up those as part of the fundamental human right?
So it's an excellent question. And because of the broad language, it doesn't specifically include or exclude that. But I think you bring up an excellent point. And most systems that are being considered absolutely include those.
Okay.
Yeah. Beyond, healthcare in this country gets to be so arbitrary. I mean,
Yeah.
the eyes, the hearing, dental care, these are all part of the human body, and yet they're not necessarily, standard included in healthcare. So I think, whether it's your point as to other, I'm a fan of allopathic medicine, but to other non-allopathic medicine options, I think that, more people need better healthcare. So it's an excellent point.
The other, and you hit right on it, is the other kinds of medical care. I know from my professional experience, one of the really common problems faced by children in school is dental. It isn't the broader health issue; it's the dental health can become really a barrier for kids at school. Does this pick up dental health as well as ophthalmological or optometric, all the rest of the?
So it's a great question, and it's my understanding that Healthcare for All Oregon agrees with you and with me is that their efforts would include those things.
Okay.
Again, we're not talking about Medicare for All tonight. That there's no chance to get there this year at the federal level. I'm just talking about local action. But when we talk about Medicare for All, as activists, it means new and improved, which includes dental, vision, hearing, those things. But again, really, I'm just asking us to take the stance that we support voting for that state constitution amendment, which is stating that healthcare is a fundamental right. It doesn't have the specific, how do we go to get there? But everybody working on it shares the opinion that, yes, it would include those things.
That's great. I hadn't had a chance to read any of the bills involved, and I just wondered, I have watched over the years as the allopathic model has excluded so many other forms of healthcare. And I just wanted to find out kind of what your thinking is. It sounds really reasonable. Thank you. Councillor Hoy.
Thank you, Mr. Mayor. I just had a couple of quick comments. One of the comments I just wanted to address. Sometimes we're asked, why is the city weighing in on something like this? Why is City Council taking a position? And I think that I just want to say that, in my opinion, is it's important that we offer our opinion on certain things when it's of such universal import as something like healthcare. And certainly this impacts every resident, every person who works in Salem, and it also impacts the city fiscally. We pay a lot of money every year for health insurance for the employees of the city. And the fact that not everybody enjoys that kind of healthcare coverage is really, in my mind, in this country, it's criminal. I mean, for people, I shared with you all that during the last year I experienced Bell's palsy, and I'm still experiencing a little bit of the effects of it. But in the course of that, I've had the opportunity to talk with a lot of people about their treatment options and things. And you asked about some alternative medicines, and I personally receive acupuncture every other week, and that's been a huge part of my recovery. But there are so many people I talk to who can't go to that because they can't afford it because it's not covered under their insurance. And the fact that I can get a treatment for my health that somebody else can't is just not right. And I'm really proud to support this. I hope everybody will, because I think it's the right thing to do, and it's critical. Thank you.
Thank you, Councillor. Councillor Gonzalez.
I tend to vote in favor of this. I actually first became involved in healthcare discussions during President Obama's first term. I advocated for a better healthcare system locally, statewide, and went to DC twice, actually. It was a small business voice. It was an important one. And it was so important at that time that my friend, he actually got invited to the White House lawn, to the State of the Union address. Actually, I think he sat by Michelle at that time. And I think I was second choice, but, Jim Hauser, Jim got lucky, But in addition to, here in the state, I was appointed by then Governor Kitzhaber to cover Oregon. For those that remember that fiasco, I was able to see in detail, the issues, the problems with this, the system coming from the outside, So here's a couple of things that just sort of keep me up at night. I just sort of want to throw out now. First is I think we need to disconnect our healthcare from our employment. So can you imagine if we connected our car insurance payments to our employment? So I think that's one of the first things that we have to somehow get through. And then second of all, as I'm thinking about the costs, I'm just, as you know, as a small business guy, every line item counts. And when I look at this, I'm thinking, well, which of these costs can we rein in? Medicine, medications, I'm hoping. Salaries, you know, who's going to take less? Are we going to be okay with a decent looking hospital and not just a fancy one? Are we okay with just something simple? Or when a doctor can't really tell us what's wrong with us, but we demand that they run every expensive test, I mean, no matter the cost. You know, those are the few things that I just keeps me up at night. But I do know that if we had good health care from birth, we would have what we want. You know, so thank you, Councilor Phillips, for bringing this to us. And but we have a lot of work to do.
Councilor Nordyke.
Thank you, Mr. Mayor, and thank you, Councilor Phillips, for bringing this motion. Healthcare is a fundamental right. I fundamentally agree with that, wholeheartedly agree with that. And even though we have absolutely zero jurisdiction over public health, it matters that we as leaders speak up and demonstrate the need for this, because we have relationships with other leaders in the communities. The public health departments are run by the counties. They need to know that this is important. They need to hear it from everyone, other elected officials, all their constituents. The state of Oregon needs to hear that. We know that the state is finally prioritizing mental health as part of medical health, and I'm excited to see that. There is a huge amount of unmet need, and I don't think anyone can say it better than the testimonials we've already heard from people who signed up and had the courage to share their personal stories with us tonight. As someone who has volunteered in the camps at Wallace Marine and Cascade Gateway, I can tell you that lack of access to health care is a cause of homelessness. I have spoken to individuals who lost everything because when their medical bills got too high, they could not afford to keep a roof over their head. It is one of the causes out there. And unfortunately, there are so many people who are just one bad health event, one unexpected healthcare event away from losing everything. And in this country, that is appalling. It's completely unacceptable. So I'll be glad to support this motion. Thank you, Councilor Phillips.
Thank you very much. Councilor Stapleton.
Thank you. Yes, and very quickly, I just want to thank you, Councilor Phillips, for bringing this forward, and I intend to enthusiastically vote yes for this, and I echo all of the wonderful, beautiful things that have been said by fellow councilors.
Thank you. Councilor Lewis.
Real quickly, I too want to thank you, Councilor Phillips, for bringing this forward. When I think of fundamental rights, I think of the main three that this country is built on: life, liberty, and the pursuit of happiness. When I zero in on those, life to me means health. And certainly the pursuit of happiness. If you're not healthy, you should have the right to pursue that health. So I feel as though that we've had these rights ever since this country started. The practice is something that needs to be fixed. I don't know if I agree, Councilor Phillips, that the system is not flawed. I believe it is, and that's why we're here. And that's hopefully what we will get out of this in the near future here in Oregon, and eventually in the whole country.
Okay, thank you. Anyone else? Okay, if the recorder would please call the roll.
Councilor Phillips.
Enthusiastic, aye.
Councilor Leung.
Aye.
Councilor Gonzalez.
Aye.
Councilor Hoy.
Aye.
Councilor Nordyke.
Aye.
Councilor Lewis.
Aye.
Councilor Stapleton.
Aye.
Councilor Anderson.
Aye.
Mayor Bennett.
Aye. Motion passes.